Hi there, I am Dr. Jennafer Jarosz of Strategic Strides Animal Chiropractic, and I'm coming to you live again with an interview tonight with Dr. Lindsay McMullen, who I work closely with because I am affiliated a bit with ProAction Sports Injury Clinic, who I highly recommend to all my patients and clients.
Thanks.
Lindsay's a chiropractor there. I refer a lot of people to you, so let's dive right in. I want to ask you, because usually everybody who is a chiropractor becomes a chiropractor for a certain reason. Why are you a chiropractor? What made you choose that?
Well, I've always been interested in sports medicine. I always participated in different sports growing up. I grew up under the tutelage of my mother, Grits McMullen, who has been a coach in the area for, I shouldn't say 100 years because she might watch this at some point. But anyways, I started riding at a very early age. I think I was riding, in the womb, and then officially started riding at the age of 4 at Red Checkers, which is now Ashland Farms, and rode for, still riding, obviously. After high school, I went over to Germany, and I had a riding job over there when I was 18 years old. And when I came back, I was riding a fair number of horses at home, and I just started my undergraduate degree at the University of Ottawa. And I started to notice that I was having some pretty severe low back pain, which is a very common condition that riders do complain of. And like most of us, I would just ignore it. I passed it off as, something irrelevant. And it got to the point where I was medicating, not just when I was jumping, but it got to the point that I had to take some form of medication every time I rode. So, being at least I was doing a degree in human kinetics at the time, I thought, well, this is kind of crazy. I'm young. I shouldn't be having this kind of pain. And I ended up consulting with my medical doctor, and she said, oh, you just need to go see a chiropractor. And I thought, okay, well, I don't know if I really want to go see some sort of witch doctor or something crazy. But, she said, no, I think that would be the best bet. And anyway, no one that I knew of in my family anyways had seen a chiropractor before, so I was quite nervous. And it just so happened that during, around that time, Sue Sarazin was over at our farm. She had brought some students over to do some cross-country schooling. And I started chatting with her a little bit about this, and she said, oh, you should go see my chiropractor, Shannon Rampton. She's just up the road in Carp. And I said, sure, why not? And anyways, I was in so much pain for, I think it was probably around 6 months. And I just thought, you know what, like I didn't want to stop riding. I didn't want to keep having the same problem. It seemed to be progressing, and made the appointment. And I would say within a very short time frame, she had me riding pain-free, which was huge. And I didn't realize, to me, after being in that amount of pain for that period of time, and hearing so many people that deal with a similar issue, to me, it was a pretty simple fix. And I wish I obviously saw her at the beginning. But anyway, it really did make a huge impact. I still pursued going towards medical school. I was looking into physiotherapy, and I ended up having the opportunity to work with he's another local chiropractor. His name is Dwayne Smith, and he works with all the heavy hitters in Ottawa. So Athletics Canada, he works with a ton of NHL players. I always say you pretty much have to be somebody to get into his office, but he introduced me to one of the techniques that Shannon and I utilize in our office, which is called active release technique. And that just changed my perspective on what chiropractic can do. So it's not just for, everyone thinks, so it's just about adjusting joints, but really it comes down to treating anything that's related to the neuromusculoskeletal system. So, and that's about it. But
Yeah, and I met you, I think it was back in 2012 or 13 it was, because you came and shadowed me. I just came to Ottawa, and because of my immigration status, I had to work in a human practice.
Right.
So I met you while you were in school, and we kind of connected that way. After I met you and your personality, I said, you need to meet Shane because you guys are
I thought that was funny actually, because I think I had probably asked if it would, knowing Shane a little bit more now, I think I was probably asking a fair number of questions, and you're like, well, you should meet my husband. You guys,
You
I
guys.
guess I don't even know if you guys were married at the time, but anyway, I just thought it was funny. But yeah, I mean, crazy how it is a pretty small world for sure. So.
Yes. So, we were talking because I mean we were both horse people. You knew I was treating horses in the area as I was working in the human practice, and we kind of got on a conversation about well, how you became a chiropractor and stuff like that, and you saw the need for what you share, low back pain, that's very common amongst riders, hip pain. And how did you, like, because your niche now I would say is treating equestrians. I mean, you treat other people, but you do have a fair amount of equestrians that come into the clinic. Why do you feel that chiropractic is such a benefit for the horseback rider?
Yeah, I feel anyway. I mean, I 100% agree. I think, certainly in office, I probably see anywhere between, 50 to 60% of my patient base at any given time are horseback riders. For me, anyways, it's as much about educating that patient population, because for me, also integrating rehabilitative exercises and just tailoring those type of exercises in and amongst our riding routine really does benefit just the everyday rider to the professional. So certainly with riding, and you come across this every day in your practice, is there's a lot of asymmetries that go on. So kind of basic knowledge with chiropractic care, everyone says, oh, my hip is out, or I feel out of alignment. And while that's a portion of what we address in the office, certainly asymmetry is one of those things. For us anyways, is we want to look at certainly we'll do muscle testing. We'll look and see how posture has something to do with play. But because we do a lot of functional testing in the office as well, we really do get a sense of how the body in motion has some sort of biomechanical deficiencies. So just riding as a whole is a pretty complex pattern of movements. So when we do have patients come into the office, instead of, I always certainly ask probably more questions than the average chiropractor. So, I know when I first started seeing a chiropractor, luckily she had been a rider herself. So, I was able to say, when I pick up the canner, this is what my hip does. I could actually use that type of language, but I'll usually ask those type of follow-up questions, because especially if I'm dealing with a rider that's riding multiple horses and that problem spans across every horse on their roster, it usually, as you know, is rider specific in terms of their issues inhibiting the horse's way of going versus the other way around. So by asking, if you have a horse that's with a lead changes late behind, or they tend to drift inward on the left rein, or so on and so forth. It's a live show, everybody. Those type of questions can give us a little bit more insight versus, where's your pain, and just treating and focusing our treatment around that. Especially for us, because of how our clinic operates, we're kind of like a hybrid of, not just, your standard traditional chiropractic, but we're kind of, I always say we're almost like a blend of physio, athletic therapy, and chiropractic. What we're really doing is we're addressing the body holistically. I don't even know what the rest of your question was, but anyways, it's, to me, I think it's really important for riders to integrate not just obviously passive care, like going to see the chiropractor, the massage therapist, or physio, but also integrating, okay, what other exercises can I be incorporating in my day-to-day routine that can help supplement my riding, so I can better help my horse do the job that we're expecting it to do.
And I see that coming from a human chiropractic side first, as my background before I went to the animal chiropractic school. I'll see a lot of stuff with the horses, especially if I go to a farm where it's a one trainer, the trainer rides most of the horses. And after I've worked on a series of horses, I'm finding the same thing, right?
Mm-hmm.
Right-sided neck issues, left-sided hind end issues. And after a while, after maybe like 4 or 5 horses, you're like, okay, not every horse can have the same issue. So where's that stemming from, right? It's stemming from the horse compensating for the actual rider. And the other thing I've seen in the past too, which I always find interesting, is someone who has part leasers. I had one client who, she had a meniscal issue in her knee. So she always compensated how she was riding. She was always compensating in the saddle. So her leaser, who never seemed to have any issues, she would always say, after I ride, when she's had 2 days on the horse, she actually needs to see her chiropractor the next day because the horse was so off compared to what she was used to. You know, so our body language, and we work with Jennafer Dirksen, you and I, the rider mechanic, she'll tell you right there, your body language can speak for how your horse moves. And sometimes it's not just a quick fix. Sometimes your position on the horse stems from pain, or stems from, like you might see, a long-standing issue that's created scar tissue. So sometimes you can't just fix it slightly because you'll always revert to the original. So that's why having the issue treated will improve your horse. And what I see, you know, so there's many times when I'm watching a horse on a trot line, sometimes I always end up stemming to the rider, and I'm like,
exactly.
right? So it's hard to miss, but we can't always blame our horse. Sometimes it comes from us.
Right.
So speaking of conditions that riders have, what do you find? And I know this can be hit or miss for anybody, but what are the most popular conditions you think that riders are affected by or have problems with?
I'd say certainly in terms of common complaints, you know, I find pain obviously brings people into the office, probably first and foremost. And then, you know, we talk about asymmetries from there as well. But in terms of, you know, someone calling in for an appointment, what would kind of encourage them to make an appointment would be something like pain or dysfunction in the sacroiliac joint. So often, especially with falling off horses, I've seen, myself included actually, I've sprained my SI joint. So just having that, just that instability and lack of motor control of that area really can cause a long-standing issue. So again, and it's not just we need to adjust the joint, it's really looking at, and you know this obviously being a chiropractor yourself, it's looking at the pelvis as a whole and addressing the dysfunction. Usually we were looking actually at the other side, of course. So that's certainly one issue that comes up. There's a lot of complaints in regards to, I get kind of twisted in the saddle, and it's funny, and I'm sure you do this too when you're watching riders. I know I do. I find I'm looking through a slightly different lens. You know, I coached for a number of years, so I often would have my eye drawn to the rider, but of course now I'm thinking of how people are riding based on what's happening from a biomechanical standpoint. So even I've been fortunate enough to work with Jennafer, and certainly awareness is step one, but secondly, with a lot of these long-standing issues, sometimes it's not just being aware of the issue. Sometimes we actually have to go in there and address the issue off the horse separately. So whether that involves some sort of passive care, so you're getting treated by a practitioner, or active care where you're adding in different movement patterns to help kind of, you know, from a neuromuscular standpoint, just correcting that motor pattern, that movement pattern. You know, that's step two. And then step three is obviously having someone with an educated eye to say, yes, you're on the right track doing what you're doing. But I would say, yeah, definitely. I've had riders also complain of having pain in their ankles. Certainly with the hunter jumper world particularly, we do favor riders that have a lower, quite a deep heel, and realistically that's not necessary. We really do need our heel does need to be lower than our toe, but to have that extreme angle, there's nothing else in life where we are expected to be in that position, and that overloads the joint considerably. And often I'll get complaints of, well, my ankle hurts. It's like, well, yeah, because over time, just that impact can really be quite detrimental to the joint itself. So adding in, having some work done on the ankles can be helpful. I know that was something that I had to do, but from a long-standing perspective, doing some mobility work. So in the office, Shane and I use a system called functional range conditioning. It's excellent just to help build up some proprioceptive feedback within the joint, and that can certainly help when we are in the tack, of course. But and another issue that does come up, obviously we never plan on falling off. Hopefully at this point all of us do ride with a helmet, but you know, one of the most common myths is that a helmet prevents concussions, and that's certainly not the case. But concussions are something that unfortunately can be a long-standing issue, but often I find if we can kind of and be involved in early intervention following head trauma, we can make a big impact in terms of the longstanding visual vestibular issues that can occur. But I'd say those are kind of the majors. But again, like it is typically more of a mechanical issue when it comes to low back pain. So, and that's not, I would say it's a simple fix, but not necessarily an easy fix. So it's simple in terms of concept, but to get that, to address that issue after, you know, someone such as, you know, yourself or myself, we've been riding for, again, 100 years, you know, it does require some, and it's great right now in quarantine because of course, all my patients have to listen to me and have to focus on the exercises that I've given them. And they've said, you know, this is actually like, I don't know why I haven't been doing this whole time. And it's like, yeah, like this is gold. It really does make a difference because as chiropractors, we're to facilitate change, but we're not just fixing the problem and creating, you know, putting a Band-Aid over the issue. We want to find a solution. The goal is to kind of empower patients to take care of themselves.
Yeah, that's so true. I want to touch real quick. I don't want to keep this too long for everybody, but I want to touch on stuff that you do because I do, you know, when I'm treating a horse, a lot of times I find there's people who say, well, I've never had a chiropractic adjustment myself, but yet they have me out for their horse, right?
Yeah. And, we always take better care of our horses than ourselves, right?
True, right? But then, you know, I had people say, well, I heard, you know, it's 2 minutes, you're in and out, and it didn't really do anything for me. Or then they want me on a program and they want you to come back all this time. And I said, well, it's who you go see. And it's their philosophy and their belief on how things work, right? And one of the things I find how I treat a horse, I always say, if you like how I treat a horse, you'll like how Lindsay treats you, because we have that same kind of philosophy, soft tissue.
But I say the same. I'm like, yeah, go see Jenna.
Right. Is a huge key in the problem. It's not just the joint level. You have to look at all surrounding structures. So tell them, because I mean, ProAction Sports Injury Clinic, soft tissue base. You mentioned the active release technique, which is basically working on the soft tissue in a range of motion. But tell them what other modalities that you guys tend to use at the clinic in case they didn't know.
So when we do talk about soft tissue injuries, it's usually, it doesn't necessarily need to be an injury. That's maybe a bit of a misnomer, you know, any sort of condition. So soft tissue problems do arise from kind of repetitive stress strain type of issues, including rotting. You know, rotting is especially depending on who you're rotting, it can be a certain amount of trauma. But basically the modalities, the tools that we use really address scar tissue. And scar tissue can either come from acute trauma like falling off, or repetitive stress strain issues, or even chronic tension. So kind of poor posture over time can really be an impact. So active release technique is the gold standard for addressing that. We also utilize Graston, which is an instrument-assisted soft tissue mobilization technique. That's a huge mouthful, but it basically, I would say it looks like, you know, a butter knife. I need to stop calling it that, but it does break down scar tissue that exists more in the superficial layers. And then we also use shockwave therapy, which really is effective for a number of different conditions, but certainly for anything like heel spurs or any sort of Achilles tendinosis, or anything that requires a lot of penetration or depth in the tissue, it can be really helpful. And, just like yourself, we also do acupuncture, but certainly it's kind of the hybrid of all these tools that really does make the difference. It's not just your typical carpenter and hammer approach where, we're just, if we're a chiropractor, we only adjust. That's certainly not the case with us. We do a lot more than that. And actually some of my patients, I don't even adjust. I know I've had, certainly with the riders I've treated, I know one of the riders that I worked with a few years back, she had torn her MCL, ACL, and medial meniscus, was supposed to be on crutches for 12 weeks. World Cup was on at 13 weeks, and we never took her out of the game. We just, she was 100% compliant with her exercises, very dedicated. And we helped just remodel some of the tissue by doing the work, by doing certainly the active exercises, and the treatment in the office really did make a big difference. So, certainly our goal in office isn't necessarily to get you to the World Cup, but our goal is always to get you back to doing what you love. So whether that's riding, or if, heaven forbid, if you're a runner, but certainly in the case with you and I, riding is huge. And, had that one day when I walked into my chiropractor's office and she said, "You know what, Lindsay, riding's really hard on SI joints," which is also true. So is running. I do both, but, you can't ride anymore. Like, sorry, find another sport. I would have walked out and probably not be chatting with you right now. But
I think a lot, not to interrupt, but I do think a lot of doctors or specialists that from a health standpoint too, if you come in with sometimes the laundry list of issues that are affecting the riders, I have heard clients say, they just told me, well, you should stop riding, right?
Yeah, because it is, and I mean, to be fair, really realistically, that's a logical approach. But the difference is, why would we give up one of the main activities, one of the reasons why we, get out of bed in the morning? I think it's really pertinent to certainly do everything we can to keep doing the things that we love. So certainly as a practitioner, that's always my goal. Doesn't necessarily mean that therefore it's the fastest route to getting back to being 100%, but certainly again, I think there's so much that can be done with the type of work that any sort of conservative care practitioner does, whether you're an athletic therapist or physiotherapist or a chiropractor. So
you heard it, folks. You have to not only get your horses adjusted, but you need to get adjusted too, right?
This was Jen's lecture.
Yeah. Oh, like I said, it's nice that I come from both backgrounds, like going to school for the animals and like I said, I see it, but sometimes, everybody wants me to be that miracle cure sometimes for that horse's back pain, or the horse always veering to the right. And sometimes it can't be fixed until you fix the whole problem, right?
Yeah.
And I say this, I preach this, it's not a one person sport, it's a team sport.
It is. It absolutely is. And that involves, obviously, you have your support staff with the farrier, the vet, the equine chiropractor, and then with the rider standpoint, you want to be making sure that you're doing some sort of cross training, whatever that looks like, making sure you're eating well, making sure that you're like you're fitting into a schedule, and then obviously having the right team, like you mentioned at the beginning. Jennafer Dirkson's been certainly integral for me, just with the time that I've had the privilege to work with her. She has certainly changed my outlook, and therefore, when I am working with your quote unquote more traditional type of coaches, I've been more effective because I've been able to be in the right position, because I've never been a very natural rider. I'm 5'4" and I'm all body, no legs. And I've never had the body type to ride necessarily effectively. And I've always felt that's held me back in some way, but it's really not the case. It's just having kind of the right input, whatever that looks like, whether, it's the right, it's the right therapy, it's the right treatment, it's the right therapy, or it's, the right input from the right coach. It's in the right time. So I think you're right, like 100%, it is the team sport. And I feel like going forward that the riding community is really embracing that, which, certainly I'm happy to be a part of it. But
I was very impressed. I am still very impressed. Like, I've only been here since 2012. I always thought that I'd end up going with some of my US clients to Arizona in the winter, because I'm like, who's going to ride in that kind of temperature?
we're crazy. Yeah.
Like, you guys,
Hardcore.
the Iowa community and the surrounding area are diehard riders. The intensity that everybody puts into the sports impresses me. And I guess the community, right? It doesn't matter if you're a dressage rider or if you're a hunter jumper, everybody helps everybody out. Everybody recommends things if it's helped them in the past. And so, I've heard your name thrown out there. And I just think, everybody tries, they try to improve their team, right? And they try to pass that on if it works. So with that being said, I want to thank you, Lindsay, for taking the time to come chat with everybody.
Thank you.
If they want to find you or any information, check out ProAction Sports Injury Clinic on Facebook, on Instagram.
All the social media.
Yes, all social media. And they can reach out to you directly too if they have any questions, because if they are a horseback rider especially, you're the gal that I always refer to, because you do the sport, so you understand it.
And I'm always happy to answer any question, honestly. Like, I'm an open book. I love talking about issues that do come up. It's a real passion of mine. So I've really had a great, just in the period of time that I've been a chiropractor, I've really, just like yourself, Jen, I've been amazed with the amount of people and the amount of work that people, they take this very seriously. And to me, I love to be a part of that. And I'm happy to, be a part of that in any context. So I'm here to answer any questions, to provide any support, whether it's an exercise or some advice or what have you. We're here as a resource, and certainly during this time too. So
yes.
Yeah.
Well, everyone, thank you for watching. And Lindsay, thank you again for being a part of this interview.
Thank you. Have a great evening.